All right, and we are live. Hello, everyone, and welcome to our Facebook Live. Today, we are going to be talking about why meds and ablation aren't enough to treat AFib. So I'm Dr. Hurst. I'm a cardiologist. I've been a cardiologist for, I don't know, about 15 years now, and I've taken care of thousands of people with atrial fibrillation, and I have some information that I want to share to help people that are trying to get the best outcomes from their AFib. And, just a little bit of background before we get started, just getting people engaged here, is that atrial fibrillation is a problem that has been increasing at epidemic levels. And I'll show a graph that illustrates that here in just a bit. But what a lot of people with atrial fibrillation aren't aware of is the opportunities they have to dramatically improve their outcomes. And so that's really been my passion and purpose for some time, is to let people know about the opportunities outside of the doctor's office to get the best outcomes. And I want to emphasize here that this is not in excluding expert medical care. Expert medical care is really important and something that I advocate strongly. But for people that want the best outcomes, they need something more than just what happens inside the doctor's office. So I'm going to start with a patient story. This is a real patient that I saw that illustrated this point to me maybe about 10 years ago. So I had this patient. He was early 50s and he had atrial fibrillation, and he was really struggling with his atrial fibrillation. He had two ablation procedures. He had been on just about every AFib medication that there is, and he just kept having more AFib. And he was in and out of the emergency room. I was getting phone calls from him nonstop, it seemed like. And he was at his wit's end. I was at my wit's end. My electrophysiology colleague that was doing his procedures was at his wit's end. And we really just were kind of out of options. Like, what else are we going to do for this gentleman? And then a really weird thing happened. He just quit calling me. And I was a little worried at first, of course, like, why am I not hearing from Don? But what it turned out, about 3 months later, I saw him in the office. And when I went into the room, I thought I had the wrong room at first. It didn't look like Don, but it was Don. He had lost 25 pounds and he looked great. And more importantly to him and to me was that his AFib had seemed to have gone away. And so that was one of the first patients that illustrated to me the power that people have to get the best treatment for their AFib outside of doctor's office or in conjunction with what's going on in their doctor's offices and then the EP labs as well. But it's not the last. I've seen many patients since that time with similar outcomes, and just about any doctor who sees enough people with atrial fibrillation, which is basically all of us anymore, are going to have people that have that same story. So that's why I want to talk about today is why meds and ablation aren't enough to treat AFib. So I'm going to start here with an important point, and that is that the biggest problem in healthcare, I believe, is chronic diseases. And I know that can sound a bit tone deaf, especially in the time of unprecedented. How many times have we heard that word in the last year? Pandemic. But I think I can illustrate why this is not just an either or situation. So why do I think chronic diseases is the biggest problem in healthcare? Well, one, it's the number of people that are affected. 6 out of 10 adults now in the United States have a chronic disease. And I'll talk about what the chronic diseases are, what that means in the next slide. But 6 out of 10 of us have a chronic disease, so not much of an exaggeration if there's 3 people in a room to say 2 of them are likely to have a chronic disease. Another measure of what's most important is how does it impact the bottom line? And in healthcare, that's disability and death. And these chronic diseases are the leading causes of death and disability. And then last is, what do we spend our money on? And the CDC says 87% of healthcare dollars are spent on those with chronic diseases. So chronic diseases affect the most people, cause the most problems, and we spend the most money on them. So what do I mean by chronic diseases? These really are the 21st century epidemics, as you'll see. Diabetes, prediabetes. There's about 240 million people in the adults in the United States. 70 to 80 million of them have sugar problems, either diabetes or prediabetes. High cholesterol affects 100 million people. High blood pressure, 120 million people. Unhealthy weight, about 160 million people. And the reason these are important is because they're the primary drivers of the diseases that are killing us. Now, these diseases can be acute or chronic. Acute means something that happens suddenly that needs emergency treatment. And that, healthcare is quite good at acute illness, like heart attacks and strokes and acute leukemia, those kind of things. But if people survive that event, and because we're so good at acute illness, most people do, well, then they are left with a chronic disease of heart disease, stroke, cancer, dementia, kidney disease, AFib. And the reason that I include COVID in this is because those people who are at most risk for the bad outcomes for COVID, that need to be hospitalized, need to be intubated, that end up dying from COVID, are those people that have these chronic diseases. So this is a graph that I think is just stunning to me. And I'll have you think about this and how this has affected your life. But look at the increase in chronic disease numbers over the decades. So in about 80 years, we've gone from single-digit percentage of people affected by chronic disease to now 60% of people, and atrial fibrillation is no different. We look even like back to 2000, maybe a little over 200 people per 100,000 had atrial fibrillation. Today, it's over 500, and it's predicted to continue to increase. And atrial fibrillation also has been described as an epidemic. And I can tell you, as somebody who takes care of people with atrial fibrillation, we are overrun with people with AFib. So taking a step back, I'd just like to ask you, and you can leave it in the comments or think about, how has chronic disease affected you and your family? How does AFib, high blood pressure, diabetes, heart disease, stroke, all these other chronic diseases, how have they affected both the quality of life and maybe in the case of loved ones, maybe shortened their lifespan? How has this affected us? And the unfortunate reality is that we've all been affected or have known people, loved ones that have been affected by this. And the ultimate outcome of all of these chronic diseases is about 2,000 preventable deaths every day in the United States alone. So that's about one every 40 seconds. And we only have data, of course, up until 2019. But we all know that in 2020, these numbers, from COVID are going to be much higher than that. So the question is not what's the problem. We have a big problem. We have a lot of people that are suffering. Their health is suffering. Their quality of life is suffering. They're spending way too much time in doctors' offices and hospitals, taking medications, all of those things. How are we going to stop this? What are we going to do to put an end to it? And what I'm going to put to you to consider is that if you have a chronic disease like atrial fibrillation, then you need more than expert medical care to get the best outcomes. You also need to treat the root causes. So here's an analogy that I like that maybe can help illustrate this point. And the analogy is that our approach to chronic diseases is kind of like a sink that's overflowing with a continuously running faucet. So, if we look at this continuously running faucet with overflowing sink at the level of problems, our root cause of problem is we have too much water coming into the sink. And that's important because too much water into the sink, of course, leads to that sink overflowing, which is important because that water can damage or destroy our house or facility. Now let's look at the possible solutions at each level of problem. If we have damage or destruction to our house, of course, we can replace things. We could even move and get a new house. If the problem is the sink is overflowing, we can bring mops to mop up the water. We could put more drains in the sink, maybe, buy a bigger sink. But all of those suggestions would be ludicrous if we didn't address the primary problem, the root cause. We didn't turn the water off. Nobody would even do that. That's the first thing we do is treat the root cause. But when it comes to our approach to atrial fibrillation or other chronic diseases, the root cause oftentimes, now AFib is complex, and we know that some people can get AFib because they exercise too much, although that's pretty infrequent. There's also a genetic component, again infrequent, but for most people, the root causes of atrial fibrillation is poor diet, lack of physical activity, toxins like too much alcohol or tobacco. These are important because they lead to AFib, high blood pressure, diabetes, unhealthy weight. And those are important because they lead to the things that kill us: heart disease, stroke, cancer, dementia, and death. So how do we address, what's the solutions that we provide for each level of these problems? Well, once heart disease develops, or strokes, or cancer, we have catheterization laboratories where we can put stents in or do ablation procedures. We can do surgery. We can transplant organs now. We have medications, of course. How about for AFib, high blood pressure, diabetes? We have medications, we have procedures like ablation, like bariatric surgery for obesity. But what are we doing to treat the root cause? Oftentimes, nothing. So I guess the question you probably have now is, what difference does it make to treat the root causes? And I'm going to use atrial fibrillation to illustrate the power of combining expert medical care with treating the root causes. So we all know how it works. If you have atrial fibrillation, you see a physician who's an expert, and they can do ablation or other expert medical care with the goal that you'll be back in sinus rhythm or regular rhythm. But we also know that it doesn't always work, that there is some recurrence of people going from sinus rhythm back to atrial fibrillation. Now, what is that percentage number? Well, you probably have heard different things from your doctor. I know a lot of my electrophysiology colleagues will say that their success rate with ablation is 70%, 80%. A recent colleague of mine said 88% was his success rate with ablation. And I'm not, it sounds like I might be poking fun at my electrophysiology colleagues, but I'm not. I think they're really amazing at what they do. And frankly, I think those numbers, the success that they have is kind of remarkable that they even have it. But when we look at an unbiased source as to the success rate over the long run, so we're not just talking about for 3 months, 6 months, or a year, but over the long run, let's say 4 years, well, the numbers are not as good as 80 and 90%. Now, this is a trial that will illustrate some of these points. This is called the Cabana trial. This is the largest research study for atrial fibrillation ablation that's ever been done. It was published just a little bit over a year ago. Over 2,000 people in the study. They followed people up for over 4 years, as you can see from the graph. And the question was, how successful is a medication strategy for treating atrial fibrillation compared to an ablation strategy? And what they found was that almost 70% of people treated with a medication approach to their atrial fibrillation had recurrence over 4 years. So it's kind of stunning. I mean, 70%, we had a 70% failure rate with medication. But if you're on medications, or you know people with atrial fibrillation, or you're a cardiologist like I am, you know the medications don't work as often as we'd like for them to do. But how about ablation? I mean, ablation has to be better than medications, and it is, but not by a whole lot. About 50% of people who had an ablation procedure or ablation approach to their atrial fibrillation got to 4 years without having recurrence of atrial fibrillation. So just to frame this, now this is a study that was done in the best medical centers in the world with the best operators in the world, and still about a 50% chance at 4 years of success was the best that was done. So I think this can be discouraging, but I think there's another way of looking at this. And that's that. In fact, I think that they got those kind of results was kind of remarkable, because when you consider that the underlying root cause of the atrial fibrillation was not addressed oftentimes in these cases, it was just expert care, then even getting a 50% success rate, I think, is kind of remarkable. And what are the causes? What are the root causes of atrial fibrillation? Well, most commonly, it revolves around unhealthy weight, untreated sleep apnea, excess alcohol or tobacco, uncontrolled blood pressure, low quality diet, or being inactive, being sedentary. So the next question then is, okay, well, how good could it be to treat the causes of this? And so actually we have multiple research studies that tell us that. And I just want to briefly mention 4 of these. This is the first one. This is called the CardioFit trial. And they looked at approach of meds and ablation alone, so expert medical care, versus meds and ablation plus a 10% weight loss and improved fitness. So they did more than just help people with their weight loss and fitness. They also made sure they had sleep apnea treated. They got their blood pressure under control, taking the right medications, all of those things. So in this trial, the success rate of meds and ablation alone after 4 years was only 34%. So, this is less than the Cabana trial. It was a study that was done 4 or 5 years before Cabana, so the techniques have gotten better over time. But still, the point is, only 1 in 3 people that just had meds and ablation alone had no AFib after 4 years. Now, what was the success for the people that lost 10% or more of their weight if they needed to, and improved their fitness and treated the causes of AFib? What would your guess be? If you said 50%, that would be pretty great, right? 60%, that would be remarkable. Well, the answer was 94% of people who lost 10% of their weight, improved their fitness, and treated the causes of AFib on top of expert medical care were AFib free at 4 years. I mean, 94% effective. That's really remarkable. But what if you've already had an ablation procedure? And we have the answer to that as well. This study is called the Rest AF trial. Same thing, meds and ablation alone versus treating the causes after ablation. Meds and ablation alone at 4 years, and this is a bit older trial, only 18% of people were AFib free. If they treated the causes, 87% were AFib free. 2 other trials that I'll mention, the Legacy trial, that took people that are off and on AFib, paroxysmal AFib is what doctors call that. If they lost 10% of their body weight, 6 times more likely to be free of AFib at 4 years. And then this last trial is the Reduce AF trial. So I'll walk slowly through this one just to illustrate the point, but they took people with on and off AFib, paroxysmal AFib, and then said, well, is their AFib from baseline getting worse or is it getting better? And then they separated those into people that didn't lose weight, at least less than 3% body weight, those who lost between 3 and 9% of their body weight, and then those who lost more than 10% of their body weight. And here's the results. So the AFib got worse, and the people who didn't lose weight or didn't lose much weight, and about 40% of those people, their AFib got worse over 4 years. If they lost 3 to 9% of their body weight, they did better. About 30% didn't have, or their AFib got worse. But if they lost the 10% of their body weight, only 3% got worse over the 4 years. How many of them got better? Well, if they didn't lose weight, only about 25% of people got better. If they lost 3 to 9% of their body weight, about 50%. But if they lost 10% or more of their body weight, 88% of those people had an improvement in their atrial fibrillation. So the point of this is that the world experts all agree that the best treatment to get the best outcome for atrial fibrillation, you need more than just meds and ablation alone. You need to treat the causes of the AFib as well. And this is the guidelines. These are the world experts that come out with guidelines telling us physicians how to best manage conditions like atrial fibrillation. And this team of experts on the treatment of AFib give their strongest possible recommendation for weight loss and what they call risk factor modification, treating what we call treating the causes of AFib and helping people get the best outcomes for AFib. So I've seen this happen in multiple patients over the years. And one of our clients, I just want to illustrate his story because I just think it's a powerful one. This is a gentleman, John Barnes. He is a client of ours, and he had atrial fibrillation. In fact, he was having AFib episodes almost weekly. Like, it really was impacting his quality of life. And he was scheduled for ablation, but he was really concerned, didn't really want to have an ablation. Saw me, bought into the program, even though he tried, lots of different diets over the years and really hadn't had success. Lost 9% of his body weight, so almost got to the 10%, 5 inches around his waist. But the important thing is his AFib had gone away. He hasn't had further episodes of the AFib. So the point that I want to make, and the point I want to emphasize to anybody who has atrial fibrillation and they're struggling with it, if you're worried about, is this when is that next episode going to come? You're worried about the side effects of the medications. You're worried about the increased risk that people have with atrial fibrillation, because we know it increases stroke risk by 5 times, heart failure by 3 times, dementia and death doubles in those with AFib. Then the important thing to know is that you need more than expert medical care. You have to treat the root causes as well. And, if this makes sense to you, if there's, if you see that this is maybe an opportunity for you, then I would encourage you to contact us. Contact Rylan. She's our health coach, and she'll send you a link to our free workshop, The 3 Truths Everyone with AFib Should Know, who wants to avoid more ablation and medications. And also want to put in a plug for next week's Facebook Live, and I am going to talk about the real reason you can't lose weight. Weight loss is a real complex topic. We struggle with it here too, because what we know is that a weight loss program often sets people up to fail. But we have we've learned something over the time that there is a strategy that does work in achieving lasting weight loss and better health. And that's what I'll be talking about next week. So I want to thank everybody for joining us. Please send us any questions that you have or comments. We'll get back to you in the comments below, and have a great day. Thank you so much, and thanks for being here.